Hello, I'm Ruth Stewart. I'm the National Rural Health Commissioner for Australia, and in that role I assist the Minister for Regional Health to formulate policy to improve the health of rural and remote Australian people.
I'm Shelley Nolan, the Deputy National Rural Health Commissioner representing nursing and midwifery for the Australian Government. I also hold the role of Chief Nursing and Midwifery Officer in Queensland Health. Rural and remote registered nurses practice as generalists, delivering care across the lifespan and health continuum. They are valuable members of their community. They often live in those communities. And compared to their urban peers, rural and remote registered nurses often provide care with reduced clinical supports and are frequently called upon to respond to a broader range of emergency and primary healthcare needs. Rural and remote registered nurses work in a variety of settings, such as small hospitals, Aboriginal community-controlled health organisations, primary healthcare services, outreach and community health, in multidisciplinary teams, or sometimes as the single autonomous nurse practitioner. Some of these areas also include aged care and mental health. So when you look at the diversity, you absolutely consider the registered nurse to be broad in regards to the knowledge and the care that they deliver in those communities.
This framework is for registered nurses who want to work in rural and remote areas, where no 2 days are the same.
And where nurses are required to work to their full scope of practice.
It identifies the capabilities needed to deal with any type of presentation.
And supports the development of nurses in rural and remote settings.
If you are a rural or remote nurse, use it to strengthen your own practice.
If you're an educator, use it to inform curriculum.
If you're an employer, use it to support your employees to practice with confidence.
This framework was created for and by rural and remote nurses here in Australia. It describes the unique context of practice and core capabilities for rural and remote registered nurses in Australia, and identifies the skill set necessary for nurses to work to their full scope of practice as rural and remote nursing generalists. What is unique about this framework? It outlines cultural safe care. Cultural safe care in partnership with families, communities and multidisciplinary peers is intrinsic to the framework. The Office of the National Rural Health Commission is very proud of the work that we have done here with publishing the framework. It is contributed from the National Peak Nursing Group's Commissioner, the Deputy National Rural Health Commissioner, Chief Nursing and Midwifery Officers, the Australian College of Nurse Practitioners, Colleges of Nursing, the Rural and Remote Nursing Australian Nursing and Midwifery, Accreditation Council, the Australian Nursing Midwifery Federation, Australian Primary Healthcare Nurses Association, and the Congress of Aboriginal and Torres Strait Islanders, along with the Council of Deans and Council of Remote Area Nurses of Australia. We also have input from James Cook University, who have assisted us along with the National Nursing and Midwifery Board of Australia.
My name's Clinton and I'm a registered nurse. I've been in this role for 12 years now. I started off my nursing career at Gold Coast Hospital, and soon after working there, transitioned across to Gold Coast University Hospital. I've spent nearly 11 years in oncology and haematology nursing, and for the last 6 years I specialised with hepatobiliary cancers with the specialist cancer nursing team based at the Gold Coast University Hospital. During that time there, I'd always had a desire to travel Australia and, expand my nursing skills, knowing how much we can adapt and learn as a nurse and not just be in one area, and took a secondment up in Cooktown about 2 years ago and had a fantastic time, worked with some amazing staff and just realised the ability and the skills that are available to registered nurses to learn. So I took a journey after returning to Gold Coast University Hospital to endeavour to become a rural and remote generalist nurse, and I was fortunate enough to pick up myself a job in the program, in the rural and remote generalist program, and started that transition by moving from the Gold Coast University Hospital out to the southwest of Queensland. Spent some months down in Roma and other areas of the Southwest HHS, and then from there transitioned up to the Torres and Cape. which is where I'm now currently working. What I find rewarding about being a rural and remote nurse generalist is just the expansive knowledge that you need to have, and along with that, the skills that are required to nurse everyone from pregnant ladies giving birth through to palliating patients and providing them, the care that they require, leading to their end of life. And really, we're covering everything in between and working in remote parts of Australia. We're also utilising our skills, maximising our scope of practice, and really drawing down on everything that you need and everything that you can get your hands on to make sure that you're doing things in a safe and appropriate manner to provide the best care possible for your patients.
The framework is for registered nurses who want to work in rural and remote places where every day is not the same and where nurses are encouraged and needed to work to their full scope of practice. The framework identifies the capabilities needed to deal with any type of presentation and supports the development of nurses in rural and remote settings. In Australia, we have over 33,000 nurses who work in rural remote settings. The framework will be a tool and a guide for them, particularly those RNs who wish to transition to rural and remote nursing generalist practice in states and territories. Their employers, educators and mentors, along with health administrators employing and working with RNs in rural remote healthcare settings, will also utilise this where they employ nurses and midwives and other professional colleagues to support the capability of the registered nurse workforce.
The other group who we believe this document will be very useful for are employers and governments who are designing jobs for nurses to work in rural and remote communities, and also for the government when the government is formulating policy, thinking about who to support, what skills they want to support the development of. They can use this framework as a reference.
Rural and remote nurses care for 28% of Australia's population who live in rural and remote areas. This framework recognises rural and remote RNs often provide primary health, acute, aged care in very small teams or in isolation. Rural and remote people carry a heavier burden of disease than urban Australians. Therefore, nurses are often the only primary health care provider in rural remote communities that care for a broad range of needs for these communities, and they often have fewer resources. There are repeated calls from rural and remote communities to improve their local health services. The Australian Government and National Rural Health Commissioner recognise the importance of the role of the rural and remote nurse in these communities. And at the time of COVID-19 pandemic, it has highlighted the need for rural remote nursing generalists to be able to care for the people in their communities where they live.
Communities and community members can be quite specific about the skills and competence that they expect that nurse to have, because nurses are not the same everywhere, and just because you have nurse training doesn't mean that you're prepared for work in a rural or remote community. And this framework is all about identifying what the skills are so that a nurse can prepare for working in a remote community. A health service provider can identify those nurses who are fit for the role, and also can design the jobs that they're offering for nurses in rural and remote communities to encompass that skill set and those capabilities. This framework has been designed to prepare people to be ready to respond to the specific realities of each different community that they may wish to work in, and prepare them to be ready to understand the individual context within which they're working. Domain 1 is about cultural safety. Now, the more remote you go in Australia, the higher the percentage of the population that is Aboriginal and or Torres Strait Islander peoples. For rural and remote nursing generalists, it's really important to have a strong understanding of how to work in a culturally safe manner within a First Nations community.
The framework has been endorsed and supported by all of the national peak nursing bodies here in Australia. That is really important to the success of the framework. As a result, each of these organisations are already commencing to use and embed in their organisations and with their nursing membership. The success will therefore be demonstrated in its use and the growth and development of our nurses in rural and remote areas. The success will also be demonstrated by the employer or mentors and educators supporting this framework as a learning tool for those nurses who want to transition and work in rural and remote areas.
I think anyone who's ever had a, minor thought about moving rural and remote and out of the metropolitan area is just go for it. Like, I was in a permanent job, had a very nice job working Monday to Friday. It was all very smooth and easy for me, but I really just needed something to kickstart me and, challenge myself and realize what else is out there. So I believe that no one will, regret what they do. There's plenty of work opportunities out there. There's plenty of benefits. There's incentives. And even if it's just for a short time, just get out there and provide your knowledge and your skills to those rural and remote areas, and people will take you in with open arms, and you'll just be surprised how much you learn and how well you'll be supported. And you'll go back, if you want to the metropolitan areas, a wiser and smarter nurse.
In closing, I would like to acknowledge and sincerely thank my professional peers and colleagues for the contribution that they have made from the national peak nursing organisations here in Australia. I was very impressed that every single one of the organisations that we approached were extremely enthusiastic about working on this framework, and here we now have it published and being used as a world's first here in Australia. I also would like to thank the organisations who gave feedback, in particular our medical colleagues, our colleagues from Allied Health, and also the organisations that provide services through the PHNs or the Aboriginal and Torres Strait Islander organisations. Here in Australia, we are very, very fortunate to have so many key groups that have been interested in this body of work. So thank you.